morning. Good morning, everyone. It's so good to be on here. It looks like I know it feels like it's been a while since I've been on here, but just to introduce myself real quickly, I am Dr. Olabintan. I'm a family physician and the founder of Livingspring Family Medical Center here in Mansfield, Texas. And today we'll be discussing the topic thriving with allergies. And our guest is here. Awesome. All right. Hi, Karen.
Hi.
Hi. Awesome. Record time. Nice.
Good.
To
Okay.
see
I was trying to
you.
get
Nice
on.
to
I was
see
struggling
you.
a little bit. Good. Okay. I'm glad to see you.
Yes, you're doing good. You're doing good. So I was just telling them, just introducing myself real quickly, just telling them what this topic is about. But since you're here, we'll go ahead and start. So I am delighted to be on here with the awesome Dr. Karen Kaufman. I'm going to let her introduce herself. So I'm going to hand it over to you, Karen. Just kind of introduce yourself, who you are, and what you do.
Sure. Thank you so much for having me with you this morning and with your audience. My name is Karen Kaufman, and I am a board certified allergist immunologist. And I take care of children and adults who are struggling with symptoms of allergies and recurrent infections. And I help them to find the answers that they deserve and to improve their quality of life.
Awesome. I like that. Improving quality of life. That's so key. Not just quantity, but quality of life. Very good.
Ma'am.
So I always love to hear the story behind why you do what you do. So what made you choose the field, if you don't mind sharing with us?
Sure. So actually, it was a long journey for me, to be honest with you. And to become a subspecialist in allergy and immunology, you can get there from one of two paths, either from a background in internal medicine or a background in pediatrics. And so I was an internal medicine resident looking to find my way. And I knew that general internal medicine really wasn't for me. So was trying to find out, through my training where I best fit. And like most, residents do, we work long hours, we're extremely stressed, we're, dealing with some really, emotional and taxing patient care experiences. And it was a struggle. And during my second year of residency, I really wasn't sure, which direction I was going to end up going. And so around that time, I had a clinical rotation in allergy and immunology, which for me was just such a breath of fresh air in that it was at an off-site clinic that was out of the main hospital. And to be honest with you, I really didn't know that allergy and immunology was even a specialty I could do from internal medicine. And so I kind of, really leaned into this rotation and enjoyed so much getting to have the experience of treating both children and adults, which with a background in internal medicine, it's really just medical care for adults. And really to see that there were some major changes that we could make in the trajectory of patients' lives. And, in my internal medicine training, I was kind of at a point where I felt like, all we were doing was sort of managing chronic disease. And so really to be able to, get involved at an earlier time in life and make major changes that just really turn patients' lives around, I just felt so excited about it. So that's kind of where I found my direction of choosing allergy and clinical immunology as a specialty.
Awesome. So it was the experience. Yeah. I can resonate.
It was the experience. Yes.
I can resonate with that. All right. So let's talk allergies. Now, what can people be allergic to? Let's start off with that.
It's a good question. So lots of stuff. So, there are all different types of allergic problems. Most of what we think about are those that fall within the spectrum of immediate hypersensitivity. So this includes things like environmental allergens, such as pollen or mold spores, house dust mites, or even animal dander, like our pets that we have at home. So the environmental allergies are a major player and a major cause for symptoms. Of course, food allergies is a whole separate category. I think you and I are going to dig into food allergies a little bit later this morning. But in addition to that, stinging insect allergy is something that comes up every once in a while. And then there are different types of delayed hypersensitivity as well, including allergic contact dermatitis, where we find that to be triggered by reactivity to maybe ingredients that are in products we use, like fragrance or common preservatives or metals or what have you. So there's lots of things that can trigger that type of response as well.
All right, awesome. So just to break it down, you can be allergic to a lot of things in the air, in the atmosphere, things that bugs, their venom, so to speak, like when they bite, they do inject something in you, and so that can trigger an allergic reaction too. Foods, obviously, we know. One of the common ones I see is also nickel allergy, from the belt buckle that people don't think thing to kind of correlate.
Right.
So yes, you can be allergic to a lot of things.
Sure.
I
And
look
even medications. We didn't even talk
right,
about medications,
right.
but yeah,
Medications are a
so
big one.
lots of things.
Lots
Absolutely.
of things. Okay. Now let's dig in a little bit to seasonal allergies. I want us to go so environmental, well, seasonal allergies. Now there's a map or there's data saying that there's certain states that are worse than others as far as allergies.
Yeah.
Why is that?
Well, there's a couple of considerations to this. So the first thing is the variety and array of pollen that is local in that area. So, they always say to allergists who are moving to a new location to practice, the first thing you want to do is contact your local botanist and find out, what's blooming and what's growing around you. And so,
Okay.
just the variety of pollen and things like that, that has a major impact. The other thing that does it is climate. And so we have been seeing overall sort of a rising climate. And even here, so I live here in Northern Virginia where we have
Okay.
just boatloads of pollen, and especially in the springtime. So we have just so many different varieties of tree pollen that are here locally. But also, not far from us is the Chesapeake Bay. And with the rise in temperature, we've seen some rise in water level. And that
Okay.
has had an impact on the length of pollen seasons that we see and kind of what the winter looks like. And that sort of lays out the groundwork for, how long these pollen seasons are going to be. And then also, how much pollen is going to dump on us every year.
Okay. That's very interesting. I never thought about the botanist going to see your local plant expert, like, okay,
Yes.
what's in season, what grows around you, and what are you allergic to, and kind of try to correlate. Interesting.
Yes.
So when we look at, like, I have an iPhone, and when I look at the weather alert for each day or projection for each day, there's an air quality bad alert, and
Yes.
that's usually emailed to us as well. So what does that mean? Why and who should be concerned about that?
Well, there's a lot of things that play into what the air quality is like. So there's, some places will also post separately like a pollen count. So when the pollen is very high, that can really impact patients with environmental allergies, especially varying season to season, depending on what those allergic triggers are. But
Okay.
other things that play a role in the air quality include our pollutants, our diesel exhaust particles, what's happening in the atmosphere and the ozone layer and things like that. So there are a lot of impacts overall at the quality of the air that we breathe in. And that's important, for example, like for patients who have asthma, their asthma may be variable in control depending on what the environmental particulates are, whether it's allergens or whether it's respiratory irritants that they're bringing in. So all of those things can play a major role. Good question.
Okay, so it's something it's useful. So it kind of gives you an idea. Okay, maybe if you're going to do something outdoor, maybe not today versus tomorrow. So it's a good indicator for those who who tend to be irritated by the weather or the air quality. All right. Now let's switch over a little bit to food allergies.
Okay.
Now I've had patients ask me this, and that's why we're doing this live, because I've had patients say, when are you going to talk about allergies? Like it's allergy season here, and we're struggling. And I said, okay, sure. So food allergies, let's talk about that. Is there a way around it?
It's a good question. I think that we don't really 100% know exactly why some people are more susceptible to allergies, food allergies than others, but there are lots of factors. So to some degree, we find that it's our genetics, right? So, the genes that we inherit from mom and dad, thank you very much, right? We can't do a whole lot about that stuff. But, there is a role as well in the timing of early solid food introduction. And the pendulum has surely swung in both directions on this one through time. So, when I was growing up many years ago, it was kind of apropos at that time to delay the introduction of the more highly allergenic foods until children were much older. And in doing so, it allows different aspects of our immune system to come into recognition of allergens for the first time. And the best way we should really do that to develop immune tolerance is through the gut. And so now we have a lot of information that we didn't have years ago. And a lot of this push in the right direction happened in 2015 when the LEAP trial came out, which really talked about earlier introduction of highly allergenic foods. In particular, that trial discussed peanut introduction. But overall, we know now that earlier solid food introduction makes a big difference in the development of immune tolerance. And so we want to be introducing solid foods that are the more highly allergenic foods to our infants now sometime between 4 and 11 months of age. So, when we've delayed in the past, sometimes we recognize food allergens initially for the first time, maybe transdermally. Maybe let's say, we have a child who has maybe eczema and their skin barrier is already disrupted. And then maybe an adult who has maybe food residues on their skin or something like that is now holding or handling the baby. And so with that in mind, sometimes maybe the skin immune cells are going to come in contact with that food allergen first and allow us to, develop that sensitization and ultimately reactivity. So, it's hard. And I think that for parents too, I think they put a lot of kind of, unneeded stress on themselves because there's a lot of guilt sometimes that parents experience when their children are developing food allergies.
Mm-hmm.
And it's
Mm-hmm.
important for parents to know that, it's nothing that they did to cause it. Sometimes it's just a combination of all of these factors together. And I think that's really hard, but there's a lot of, really good educational materials, and there's a lot of good care from allergists, immunologists, and some new stuff on the horizon to help patients who suffer from food allergies.
All right, awesome. I wanted to highlight a few points, a couple of points
Sure.
that you made. You made a lot of points.
Yep.
But one is that, before the school of thought, especially for those who have young kids, the school of thought in the past was that you should not introduce foods that tend to induce an allergic reaction early. But now they're saying actually doing that early may actually offer a benefit to the child.
Correct.
Of course, we do advise that you discuss with your own doctor
Absolutely.
what's best for you, and then go from there. So that's really important. I wanted to talk a little bit about I've had patients, I'm very big on fruits and veggies. Make sure you eat your fruits and veggies. And I had a patient tell me, I am allergic to all fruits, every single one. And they also mentioned that they're allergic to vegetables too. So let's talk a little bit about the veggie allergies. I found some, I've told that they should try cooking it or steaming it first and versus eating it raw. And they were able to tolerate it better. Why is that? Why? I don't know if you could shed some light. Why is that? And
Sure.
Is that a good advice?
So this is such a cool concept that I think is so worthwhile to talk about because especially for adults who didn't grow up with food allergy, this is something that we see sometimes develop. It can develop in childhood, of course, but we can also see this develop in adulthood. And actually, the primary problem for most people with fruit and vegetable allergy, not all, but for most, is that there is a cross-reactive relationship with various fresh fruits and vegetables, nuts, seeds, and legumes that correlate with allergenic proteins that are in pollen allergens. And so as individuals develop pollen allergy, they may start to experience symptoms with these foods. And so what we're talking about in most people, maybe 90%, is going to be symptoms predominantly in the oral cavity. So itching, maybe mild swelling, tingling of the lips, the tongue, maybe the gums or the roof of the mouth, the back of the throat. And this most commonly happens with the foods in the raw form. And contrary to our primary food allergy, where we see that as you eat something, kind of things start to get worse, with pollen food allergy syndrome, which is the name of this problem, usually once these allergenic proteins start going through the process of digestion, usually things start getting better. Not in everybody though, okay? So probably about 10% or possibly less of these individuals are at higher risk of more serious symptoms of allergy aside from just isolated oral cavity symptoms. And there are a couple of predictors for that. One is patients who have had a systemic allergic reaction to these foods in the past, and that's something that we call anaphylaxis. Those patients need to strictly avoid and also have adequate emergency preparedness with an action plan and carrying epinephrine.
So systemic is, just for those who may not understand, systemic means that you have, your whole body kind of reacts to the whatever the offending agent. So it's not just itching on the mouth, it's not limited to the mouth. It's like, breathing issues, sometimes hives all over the body and such and such. Sorry, go ahead.
Yep, it could be gastrointestinal symptoms, it could be cardiovascular symptoms. So so lots of much more widespread symptoms. The other predictor for this is people who have the same symptoms with the food in the cooked form. So with your question about steaming or cooking, for the most part, the process of cooking the foods or heating it to a certain degree will denature these proteins, which means that the protein structure kind of unravels a little bit. And so then rather than being provocative of symptoms, that food is sometimes tolerated. So, for those individuals who have these problems with fresh fruits and vegetables that correlate with their pollen allergies, if they can tolerate the food cooked, the guidance that I typically give is, for sure to avoid the food in the form that it's bothersome, that it causes symptoms. But if it's tolerated in the cooked form, then that's generally okay. If the food is not tolerated in the cooked form, then again, that food needs to be strictly avoided and there needs to be a good emergency plan in place. Yep, absolutely.
Okay. Is there any advantage of trying to peel, like, of course you want to wash your fruits and veggies, but there's some suggestion that it's the chemicals, the pesticides and stuff that's sprayed
Yeah.
during, you know, farming, growing the crop that causes it. So if you wash or you scrape like carrots, you peel the skin off and eat it. Does that, do you agree? Do you think there's a difference? Maybe.
So it's not related to the stuff that's sprayed on the fruit. So you don't have to worry about that. Although I agree, washing the fruit is still a great idea, and vegetables and
Yes.
things like that. But we do find that this allergenic protein can be more kind of densely concentrated in the skin. So some people will like slice an apple and cut the skin off of it and eat it that way and see if they tolerate it. And so sometimes it's better tolerated in that regard.
Okay.
But it's interesting because it's really that cross reactivity. So when we do allergy testing for these foods, sometimes we get a big positive response, but sometimes maybe it's kind of borderline or even
Okay.
a negative test when we do allergy testing for the food. However, that correlating pollen allergen is generally
Okay.
always positive, largely positive.
Okay.
Yeah, so very interesting.
So allergy testing for those who are prone to reactions, maybe after eating certain foods, allergy testing is a good idea. So make sure you see your primary care doctor to refer you to your allergist. Really important.
Absolutely.
I was going to
Absolutely.
ask real quick. I was going to dive back to seasonal allergies real quick.
Sure.
So of course, there's certain medications that help with seasonal allergies, but what are things that you could do, preventive measures around the house? Let's say you say
Great
someone
question.
who tends to have seasonal allergies, the runny nose, the sneezing, they take the allergy medicine, the Zyrtec, the Claritin. And I'm not advertising any brand here. They use a nasal steroid, but there's still that runny nose and congestion. You're like, doc, I feel miserable. What can they do at home? And then what are next steps as far as clinical management?
Great question. This is something that comes up in literally almost every single one of my patient visits in my office, because as much as we can do without medicine, we should do that stuff, right? So we want to get good control and management on the least amount of medicine that we require. And so the first steps of that include environmental controls for allergens. So, we can do some of these things that I'll tell you about in a minute empirically, but of course it's a great idea to have testing done so that way you have a more targeted approach to knowing what exactly you do need to avoid. Things that we find within the household that are relevant allergens at home include house dust mites, our furry animal pets, and occasionally we'll find issues with mold and things like that, maybe in a house that may have like a crack in the seal of the window or even around the shower grout and things like that. So with regard to the indoor allergens, the house dust mites are probably the ones that we can make the biggest difference about. So let me just tell you quickly what house dust mites are. So these are microscopic, tiny bugs that live with us in our home environment. And it doesn't matter how often you vacuum or dust or clean your home. We all have these things. Yeah. So these little microscopic mites tend to live wherever we spend our time, because what they do is they eat dead skin cells that have come off of us already. So they're not going to crawl up on us and eat the skin off of us. Don't worry about that. But they are going to be in our space. So where we spend the most of our time with dust mites is when we're in our beds. Okay. So a couple of really simple tips and environmental controls that can be implemented around the bed includes washing all of the bed linens. So that includes the sheets, the blanket, and the mattress pad every single week with hot water. So the frequency matters, the temperature matters. The same advice goes for those who have.
I'm taking notes, by the way. I'm taking notes. All right. Mm-hmm.
This stuff is so good. So aside from doing the linen wash every week in hot water, they do make these encasement covers, which are full zipper enclosure covers that go around your pillow and your mattress on all sides, enclosed with a zipper. And these are really effective because, they're made out of fabric, so you're not sleeping on crinkly plastic or anything like that.
Right.
But the weave of the fabric is so tight that it is going to serve as a physical barrier between your body and the mites that are within the pillow or within the mattress. So that way we're not breathing in and out those allergenic particles, and we're not coming into contact with them with our skin to the same degree. So that makes a big difference. And then in addition to that, and this is something that a lot of people don't realize and may be very important for you and your patients down in Texas, where maybe it's a little bit more humid, is that the humidity is going to drive proliferation of the dust mites. So we want to keep the humidity level in the bedroom on the low side. We want the temperature to be cool. We want it to be dry in the bedroom, because when it's humid, they will thrive and proliferate. So a couple of important tips about dust mites, super, super effective.
All right. So to summarize that, I didn't want people who are watching who will watch this later. So one, wash your linens. Very important, because you want to get rid of dust mites. They live with us and they feed off our dead skin. Kind of gross to picture,
Lovely.
But they're hard to see. But washing your linens every week in hot water is a good habit to keep. Number two, having encasement covers for your pillow, important, and then keeping the temperature cool. Or your humidity low in the bedroom.
Correct.
And I would say vacuuming too, vacuuming frequently.
Correct.
With,
vacuuming definitely helps. Vacuuming definitely helps. And that's especially true for children who have dust mite allergy, who have eczema, who are playing on the floor, on the carpeting, and
Okay.
who are in physical contact with the carpet, that's definitely very important.
Okay. All right. Awesome.
For those who have for those who have furry animals at home, so especially cats and dogs,
Yes.
you know, our furry animal friends, you know, for those who have allergies to their pets. In fact, I was just in a local moms group on Facebook this morning, basically answering this very question to a mom who has a dog in her household now that she and one of her children are finding they're having allergic symptoms.
Wow.
And so, you know, some important concepts are to keep the pet out of the bedroom of the person who is affected, to maybe consider use of an air cleaner, like a HEPA air cleaner, which stands for high efficiency particulate air filter, to clean the air in the bedroom where we spend the most of our time. We want to focus on that space especially. And sometimes frequent bathing of the pets helps a little bit, especially for example, like a dog who, you know, may be bothersome to someone, not because they have dog allergy, but maybe that person has pollen allergy and that dog is bringing all the pollen into the household. Yeah, absolutely. So, you know, frequent bathing of the pet. It doesn't necessarily need to be like a soapy bath, because, you know, some veterinarians will say that that's not great for the dog's skin, but literally you can just wash them like with some water and dry them off and stuff like that, and that helps. So, but still, even with environmental controls for furry animals, it's not enough to really substantially reduce the allergen burden. So, you know, for those individuals who are really suffering with symptoms despite doing those environmental controls, really important to go see, you know, your local primary care provider and get that referral to your allergist.
That's correct. So just to summarize, for our pet lovers, I'm becoming a dog lover, and I'll share about that sometime later, at another time. But for those who have pets, you know, dogs that you're allergic to, the recommendation is, one, as much as you can, out of the bedroom, keep the pet out. Get HEPA filter. They help to purify the air in the bedroom. Very important. Frequent bathing of the pets, not necessarily with soap, but just rinsing down really could help reduce the burden of the exposure to the offending agent. And I'm sorry to call the dog an offending agent. They don't mean to do that. And then,
it's not the dog, it's the allergies.
It's the allergies. And sometimes the reason why the bathing is important is because they come from outside and they bring the pollen in. So there's an additional allergic reaction to pollen, then that actually makes it worse. So thank you for these tips. They're very, 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 very useful. And she did say, you know, see your primary care doctor to get your referral to your primary care, to your allergist. Thank you. Very good. Very good.
Did you like
very
that?
Good. Oh man, thank you so much, Karen. We're gonna do this again. I'll have more specific questions. Maybe we'll do more with the environmental allergies versus the food allergies, because I know there are a lot of questions that are going to come from this. But thank you so much for being here. I want you to tell people, where can they find you? If they want to connect with you, if they want to come visit and have their doctor refer them to you, where can they find you?
Thank you so much. So my practice is called Kaufman Allergy, Asthma, and Immunology, and it is located in Vienna, Virginia, which is one of the suburbs of Washington, D.C. So we're in the national capital area. Awesome. And if you want to learn more about me and my practice, where you can find me virtually is on our practice website, which is kaufmanallergy.com. I am here on Facebook, where you can find me at Kaufman Allergy. And also I'm on Instagram at dr.kaufmanallergy.
Awesome. And I'm going to post that information on the comment section after this live. So go ahead, follow her, like her. One of the things I do like about Dr. Karen, I have to say, is that she does answer questions on her posts. She does give helpful tips for those who are struggling with allergies. So be sure to follow her. Trust me. Okay. Thank you so much, Karen. It was an honor to have you here. It's been a pleasure being here. Thank you so much. Once again, this is Dr. Olabintan of Livingspring Family Medical Center. If you are in the Mansfield, Texas area, you're looking for a caring, thorough, or passionate family physician, I am she. You guys have a good weekend. Thank you, Karen. I appreciate this. Bye.
Have a great weekend. Thank you.